In this video, you get to hear directly from my shoulder surgeon specialist, and we take a look at phase 3 of physical therapy. Just short of week 12 and on the way to my surgeon to see what the next plan is. Hopefully I'll be able to go to phase 3 of physical therapy. Let's find out.
How you doing?
Not too bad.
You doing okay?
I think so, yeah.
It's almost symmetric, isn't it? A little lag there, but you can get there. So AFE is coming to about 155. And then right here, bend here, rotate up like this if you would. ERA coming to 80, and then at the side here coming to 30, up your back as high as you can.
That's about normal for me on both sides.
Yeah, right. And so that comes to L1. Show me on the other side. How you doing? So you got a little bit more on this side, but you know, people on their dominant side usually have a little less internal rotation. Hold here. Let me push down. Hold. Hold. Wow, you're doing great. For 6 months, I mean, you're doing tremendous.
Oh, good.
That's really good. So totally fine doing some resisted exercises now through the cuff.
Oh, good.
That's not CrossFit. Right?
No, no, sir.
And bands, that's just, you know, that kind of stuff. So now we start with bands and light weights. And so when you move from range of motion, you can do that every day, 3 times a day, 4 times a day, 5 times a day. If you do that with bands, your inflammation will just spike. It'll be really painful. So realistically, 1 time a day, 3 times a week. Okay, this is the right amount, and try to keep the reps around 20. That seems to be a pretty good number. Okay. So less than that, you may be overworking it. More than that, then you're not really giving it much, right? So you want to break the muscle down, let it recover, break the muscle down, let it recover, right? So just that's how we build strength.
Mm-hmm. Okay.
Looks great, Bill. You're doing super.
Awesome. I appreciate it.
I talked to my surgeon about 2 concerns. At times, when I'm in a certain position, I'll occasionally feel my shoulder catch. I also have intermittent tightness in my upper chest near my shoulder. Pre-surgical diagnostic imaging showed a small tear in the subscapularis and infraspinatus. I was curious if the cause of those intermittent issues stemmed from any other rotator cuff muscles. My surgeon explained that there was only minimal damage to my subscap and infraspinatus. Both were in good condition and a repair was not needed. He went on to explain what people typically experience in this phase of recovery. I wanted to bring those 2 things out because those are really the only 2 things that I'm having any kind of an issue, and it's just like, it's rare. It's not like a constant thing. It's like every once in a while I'll experience those things.
Yeah.
So anything to be concerned about? Or?
No. For 3 months, I mean, you were doing so well.
Okay.
It just looks great. And it's normal to have those type of things. Your shoulder mechanics are all off because you haven't strengthened the supraspinatus yet. Once we get that stronger, I think all those symptoms go away.
Okay. And you noticed that I had that little bit of lag when I come up here, and I come, especially when I come right to there, it gets hard. It gets really hard.
Sure.
But that's normal too, right?
Yeah, that's where your supraspinatus is most active.
That's
right
what I
through that.
figured.
We call that the painful arc.
My surgeon knows I'm looking forward to being more active again, so I asked him questions about timelines for certain activities. I had a great visit with my surgeon. He's awesome. So just got out of my appointment with my surgeon, and he said that I'm cleared for phase 3 of physical therapy. I can actually start running right now. He said that I can comfortably put a bar on my back without hurting my shoulder, then I can do that. I can start rowing in about 6 weeks, and I can dead hang in about 6 weeks. And then finally I can start doing pull-ups and some different strength types of things in probably about 3 months. So another phase down, another phase to go. Pretty excited about what's to come. Everything's going great so far. The next day, I had strategically planned a visit to my physical therapist. He did his own assessments, and I gave him the order from my surgeon for phase 3 of physical therapy. I've experienced some tightness, so my physical therapist started the session with myofascial release in those areas. Passive mobilization to loosen up my shoulder capsule. and light resistance to get the smaller rotator cuff muscles to activate. Before starting new movements, I warmed up by doing the child's pose to get my full range of flexion, followed by a few active range of motion movements I've been doing over the past 3 weeks. After I was warmed up, my PT showed me some new strengthening movements I would be doing with light bands for phase 3. Standing rows. Standing pull downs with internal rotation. External rotation. Internal rotation. Reverse fly. And serratus anterior punches. Putting something like a rolled towel under the arm added a degree of difficulty to external and internal rotation. With proper tensioning, red bands are about 3 pounds of resistance and the blue bands are about 5 pounds. I do standing rows and standing pull downs as a couplet, then rest 60 plus seconds. A couplet is simply 2 movements done back to back without rest between those movements. Doing the couplet gives me 1 set of those 2 movements with 60 plus seconds of rest between each set. I also do external and internal rotation as a couplet, followed by 60 plus seconds of rest between sets. Reverse flies and SA punches are done as individual movements. My protocol is to complete 3 sets of 15 reps on each movement. I do this 3 times per week with at least 1 day of rest between each strengthening session. During this phase of recovery, it becomes necessary to have at least 1 day of rest between each strengthening session, like you heard my surgeon talk about. Phase 3 is an important step in the recovery process. It allows us to begin developing strength in that range of motion we've been working on so hard over the past 12 weeks. Next week, I'll go over some of the nuances for this new phase of recovery. That's all I've got for you this week. See you soon.